Hi there, I'm Cassandra Cannon. I'm a licensed clinical psychologist. I am an EMDRIA approved consultant, and I am an approved sponsor through the APA to provide continuing education courses. And one of the things I wanted to talk about a little bit today is the difficulties that clinicians can have, particularly when they're trying to combine EMDR and substance use treatment, especially if you're not really into the nuances or very familiar with substance use treatment and the recovery world. Um, so I wanted to also introduce to you a handout that I have available. It's a clinician guide. It's the target selection in EMDR for addiction and problematic behavior. And the reason I created this is oftentimes when a client wants to address problematic behaviors and addiction through EMDR is okay, there's a lot of protocols, and where do I even start? And there is also another form that you can actually give to clients if you feel like that won't trigger them too much. And they can bring that to your sessions and you can go through that together. But the purpose of this clinician guide is to have everything you need prepared so that whenever it is you decide to start engaging in the desensitization process of EMDR, or even resourcing, this can help you with that too, that you have everything ready to go and you're not fumbling and trying to figure out the questions you need to ask to then begin whatever treatment protocol there is, because there are a lot of addiction focused EMDR protocols. Um, Brief recap: EMDR has just the regular standard protocol, and there are lots of other types of EMDR protocols, but the standard protocol is what's validated in research to be efficacious. The addiction focused protocols, the only ones that's really had a lot of research is the CravEx protocol. And if you're interested in all of that, you can go to my EMDR Addiction and Recovery Hub, or you can attend my continuing education course. But that being said, I wanted to introduce you to this clinician guide. And the guide parallels the client handout, as I said earlier. It's designed to help you interpret responses, identify potential EMDR targets, and connect those presenting themes to appropriate protocol adaptations. And then again, please use your clinical judgment and remain within the scope of your training and consultation. So, one thing that I will often ask, if there's one question I can ask a client, I get one, I'm asking, okay, what do you feel is driving your substance use or other problematic behaviors? A lot of clients can tell you the answer to this, and they'll usually be able to reel off a few. But as you're listening, you're also notating any themes that you may want to address. And this question generally, most of the time, it's going to be identifying a target for the actual standard protocol. And I worked in a substance use treatment program, a residential program, where I did EMDR for clients who we only had 30-ish days with. Um, And what I learned is even if you're able to really address the driving force that's previously driven substance use, your client still now really needs other support too, because now there's these neural networks and these neural pathways that are just reflexive now. And so don't assume that if you address the trauma that's been driving the behavior, that they're no longer going to crave substances, because now there's a neurological dependence that also needs to be addressed separately. And that's where making sure that your client is also meeting with their psychiatrist, their medical doctor, and any type of support group is really, really important. Now, this next question also is really helpful you want to identify the escalation point. So, when did your drinking, substance use, or problematic behavior start to feel more difficult to control? And people will often be able to tell you an incident. It's a divorce, um, a death, a job loss. Something usually is that escalation point. Um, if they can't tell you what that is, usually you can ask something like, well, when did you notice that you couldn't stop? You were drinking every day. You couldn't get through the day without drinking or using or engaging in your behavior. Those types of questions. When did you notice it was out of control? Okay, what was going on around that period of time? So ultimately, again, this is a really good fit for the standard EMDR protocol. And sometimes, if you're also noticing that there's the relapse and craving episodes are really important, then you want to address the CravEx, which is where you do the standard protocol on the first relapse, the worst relapse, and the most recent relapse or craving. And again, I addressed this earlier. What was happening in your life the couple years before your use or behaviors escalated? This is gold information. And again, this is usually the standard protocol. And I'm not going to give my entire checklist or clinician guide away because this is 12 pages and I'm on page 2. But so we'll only do a little bit more of these. And I think one of I don't know if you can see, I've got 2 dogs there. The third is somewhere in here. They're starting to get restless. But for this one, what do you see as the upsides and downsides of using? And the upsides and downsides of recovery. So this is addressing ambivalence. Everyone has a form of ambivalence with whatever addictive behavior or substance they are trying to address. And if you're familiar with smart recovery, this can also look like the cost benefit analysis. I would often use that cost benefit analysis to then identify that ambivalence. And then if there just is a lot of struggle with, do I want recovery? Then you can do the two-handed interweave. And that is beyond the scope of this video, but that's a protocol that you can use. Or the two-hand interweave. I apologize. I always say that wrong. Sometimes people really idealize their substance use. In the recovery world, we'll often call it glamorizing use or telling war stories. Then you can do the standard protocol, and there's actually a specific idealization protocol that you can use. And that idealization protocol actually was originally designed for domestic violence relationships. And so I personally just started using it with people who are idealizing substance use or their problematic behavior, because that in and of itself is a relationship. Someone's relationship with alcohol, drugs, or their behavior that's really causing them problems. If people have fears that they can't stay clean and sober or manage, their addictive behavior, because for example, food, you can't not eat. You have to eat. So you can't be abstinent from food. That's an example. Then someone needs to be in more harm management than abstinence. But if they're having fears around being able to address these behaviors, or just, you'll hear a lot, well, my life will be so boring, or how am I supposed to go to a wedding? How am I supposed to go to a work party and not drink? How am I supposed to address these things? You can address the fears in the flash forward protocol. So this question, what do you see as the upsides and downsides of using, the upsides and downsides of recovery? That helps you create targets for these protocols that I've just mentioned. And I think maybe we'll do just these last 2 questions. Are there any big decisions you need to make soon? And if you are in a residential treatment center and you're working with residents, we call them residents or clients. Um, do they need to go on disability? How do they address employment? Do they need to live in a sober living for a period of time? Um, they're struggling with, is this relationship or friendship helpful to my recovery? Um, are there any big decisions you need to make soon? You're writing all that out. And it's identifying stressors or transitions that might impact relapse risk. And so that actually is good information to help them with their relapse prevention planning. And not to be too salesy, but I have one of those. I actually have two. I have one that's for somebody who's new in recovery, identifying their triggers and then how you address them. And then I have one for someone who's more seasoned in recovery and has figured out all of these things through trial and error, and so it's a little bit more focused for them. But this can help you identify risks to relapse and how do you address that. And again, let's say there's someone who, they really do, in your opinion, need a sober living facility. They are totally against it. You can maybe not only with motivational interviewing, you can apply the two-hand interweave to help them kind of suss out the risks, the benefits, their fears, all of that. And then this last one I'll do is, when you drink, use, or engage in that behavior, what feelings are you hoping to feel? Um, this is this is to help you identify what needs they're trying to get met, and then maybe how do you get those needs met in a more healthy way. And this can help you with preparation for the CravEx resourcing, because there's a resourcing section in CravEx. It can also highlight the positive feeling states appropriate for the feeling state addiction protocol. And something to note about the feeling state addiction protocol, that protocol is really looking at what are these feeling states that you're really trying to get, that you feel like you need, when, and identifying whether it's belonging, safety, security, all of these things helps you then address that connection between substance use or problematic behaviors and that seeking of that need that they're trying to get. I hope that this was helpful. If you have any further questions, you can always shoot me an email at Dr. Cannon at cannonpsychology.com. You can also comment on this video. And if you have questions or want to access this tool, you'll also find that in the comments below. Okay, hope that was helpful. Thanks.